Hello friends, this is Dr. Sameen Afzal Junejo from Afzal Eye Clinic, Hyderabad, Sindh, Pakistan. Friends, golden ring formation during the process of hydrodissection and delineation is a good sign for the comfortable and good phaco surgery, because golden ring is only formed when the nucleus is completely separated from the epinucleus and there is a round light emitting in a circular fashion around the nucleus, and that is actually the retroillumination when there is a complete separation of nucleus from the epinucleus. Now this usually occurs in the process of hydrodissection and delineation. Now once you get a golden ring, it is indicative of a good phaco, in a sense that the nucleus is not too hot, it is not more than grade 2 in density, and the phaco settings should be at minimum level, not more than 50%, and also the vacuum should remain high, more than 500 millimeters of mercury, and the flow rate not more than 40 cc per minute. So in this way you can set your fluidics, you can set your phaco ultrasound energy, you can set your vacuum levels when you see a golden ring around, because in grade 3 density nucleus, or in even grade 4 mature and hypermature density nucleus, you cannot get any golden ring. This is only obtained in case of grade 2 nuclear density, and whenever you get a golden ring, you should be quite assured that the phaco the process will be comfortable and all the steps will take place without any complications. So this is how you can manage your surgery, you can manage your the line of action. Now in this video I have tried to highlight different cases of phacoemulsification which I did at my clinic, and the formation of a golden ring in case of as a first step towards the phaco surgery. And whenever you do the hydrodissection, you try to separate the nucleus from the epinucleus, and hydrodissection is the process which can result into the formation of a golden ring. And at the same time you also see a very clear fluid wave which is running all around behind the nucleus, in between the space in between the nucleus and the posterior capsule, and this is also a good sign of the separation of the nucleus from the posterior capsular bag. Now these are few surgeries which I have done showing the complete formation of a golden ring, and also there are so many other positive signs during the first steps of the phacoemulsification, when you feel like you don't have to bother for the phaco surgery, you don't have to struggle for the phaco, you don't have to increase the phaco ultrasound energy, and you can most of the time you can use the high vacuum instead of the releasing the phaco energy, and you can save the corneal endothelium, you can save the inside the structures of the eyeball, and also you can minimize the ultrasonic harm to the eyeball. And because ultrasound it is the energy, actually it is the energy, it is the heat which is liberated from the phaco tip that can damage the corneal endothelium, that can also hurt the pupillary sphincter, and patient can result into the semi-dilated pupil postoperatively, and patient can complain of the light sparkles, excessive light passing into the eye, flashes of the light at the night time when the patient is driving after surgery, and when the pupil is semi-dilated, and due to the sphincter damage. So these are the complications which can take place when we sometimes can take place when we apply high energy in the form of a phaco ultrasound power. So the golden ring is actually, it is a predictor for this phaco surgeon, and can tell the news, good news, that the patient, the nucleus is not more than grade 2, and that the phaco emulsification process will take place in minimum, applying minimum phaco energy and maximum vacuum, and the patient will not develop any future high energy ultrasonic energy complications, like in the form of corneal endothelial dysfunction, in the form of bullous keratopathy, in the form of semi-dilated or mydriatic pupil, and many other, and also the pupillary chewing. And this way you can minimize the complications of phaco energy just by having a look onto the formation of a complete golden ring. Thank you very much. My dear colleagues, if you like this video,